now joining us to talk about your health is Dr. Jessica Lee, an internal medicine physician at the University of Maryland Medical Center and assistant professor at the University of Maryland School of Medicine. Doctor, thank you for being with us, and Happy New Year. If it's still January, I could say Happy New Year.
Absolutely. Happy New Year. Thank you for having me.
I think we're early enough in the year that many people who started the year with resolutions and plans to work out more, lose weight, haven't thrown in the towel yet. But we're getting to the point where maybe willpower is starting to fade. What do you think?
I think so. I think this is the time, everyone's coming in for their physicals, they're feeling motivated. Actually, a lot of my patients think it's the worst time to come see me because they have just had all their holiday eating, holiday splurging, holiday drinking, that they're feeling motivated to come knowing that they have to see their doctor for their blood work, for their weigh-ins, for their blood pressure checks. So I think it's still early enough that patients are feeling motivated for themselves and to keep their primary care doctor happy.
Watching a lot of football over the weekend, I saw a number of times a really effective, I think it was an Apple Watch ad, although this would work for any of those similar devices, about how the device was able to remind somebody that you need more steps or you haven't gotten your heart rate up enough. You think that's useful?
Absolutely. I've seen coworkers and patients, and actually a very good friend of mine has an Apple Watch, and it'll go off, and then the Apple Watch circles will go off, reminding them it's time to get up and move around. I worked with an attending physician when I was a trainee who had a stepper in her office, just in between patients, would get on the stepper for 50 steps. So I think people these days just need those reminders. It's so easy to get caught in the grind of work. We've seen that with COVID. So many patients were working at home, could no longer find the difference between the end of the workday and when their evening could start. So I think any reminder to remind you to move, drink water, be healthier is great.
It's an interesting thought with the idea that so many people are constantly on the clock. Whether you're working from home or at an office, if you're carrying one of these around, you're constantly paying attention to it. And the idea of having a separation between the workday and the rest of your life, it gets kind of squishy.
It absolutely does. My coworkers and I, we all struggle with that work-life balance of going to work too early, staying too late, and then with the availability, as you pointed out, with smartphones, we're always accessible with secure messaging, with emails. It's really about finding ways to protect yourself for everyone, not even just patients, just any person dealing with work issues, life issues, things like that. So I actually personally don't let my emails push automatically. I log into my email to make sure, and things like that.
Interesting. Well, so early in the year, for people who didn't make a resolution to do something, not too late, it's still January, what should they consider?
I actually just saw online with an author that I follow something called Begin As You Mean to Go On. It's, I think, a very nice way. It was just something that said, consider something you want to do for yourself and just take 15 minutes for it. So I think we all put so much pressure on ourselves that this is the year I'm going to lose 20 pounds. This is the year I'm going to quit smoking. This is the year I'm going to do all these good things for my health. And it just feels overwhelming. So even if it's as little as 15 minutes of being mindful of your exercise, or even turning your Apple Watch on to have those exercise reminders, just starting easy, not feeling like you have to be ready to run that marathon next week. I think what I tell my patients personally is we all remember what we were like in our 20s. You just cut out alcohol for a week and ate a salad and you lost 5 pounds and were feeling great. We're not in our 20s anymore. You have to give yourself grace.
You're a lot closer than I am, but why doesn't that work when you're closer to 60?
It is everything changing. Your body has been alive for 60 years. Your blood has been pumping for 60 years. All your organs have been working that long. Your bones have been working to keep you upright against gravity. And it is, everyone, both men and women, have changing hormones. So I actually tell all my patients in their 40s that it's probably my least recommended decade. Everything starts happening and all the cancer screenings start happening. So really feeling like, oh no, I'm getting to that age. I need my colon cancer screening. I need my breast cancer screening. I need everything to happen. So it is just wear and tear of the body, not in a bad way, but just being mindful that you can treat your body like the temple it should be and be kinder to it.
I don't know who said this originally, but hear it all the time. The idea that the best time to plant a tree was 20 years ago, but the second best time is right now.
Yes.
And, the other thing you hear all the time, every journey starts with a single step. Mm-hmm. You got to do it.
You do. And that's honestly what I tell patients all the time, is to just give themselves grace. Just start. Yeah, today was a rough day. You had the cheeseburger and the beer. That's okay. Tomorrow, be mindful. Only have the cheeseburger, or only have the beer, or if you can, don't do both. Like it really is just about taking each day at a time and giving yourself that grace. And most of the time, when patients start seeing results, whether it's after a week or 2 weeks, it really motivates them to keep going. So you are your worst enemy. You've got to start.
And it's the opposite for me. To be honest, as soon as I start seeing results, I lose the motivation.
Got it.
It's like, all right, this is better, and go back to the Twinkies. I don't eat Twinkies, but you get the idea.
No, my husband's the same. When he's feeling things are going great for him, he's like, oh great, it's finally time to have my chocolate bar. I've hit my weight, I feel great in my body, now I can treat myself. I think we struggle with that as well, is the reward cycle, is to try to, now it's either buying, the retail therapy is very real, or also, being like, oh, I had such a hard week, or I've met my goal, I would really love to eat that piece of chocolate. Or I'm a potato girl through and through, so I would love to order French fries if I can. So just trying to find that way to reward yourself, and I think being mindful of rewarding yourself differently. So still have the French fries. I would never tell patients to stop eating French fries, but order the small instead of the extra large. Little things do make a difference.
What is this concept of a dry January, and who's doing that? Who should be doing it?
Dry January started actually out of the UK. It started in 2013, and it has just become an international phenomenon that where patients who have any thoughts or concerns about their alcohol consumption just totally cut alcohol out. There are pros and cons to it, actually very few cons, mainly pros. And a lot of the time, even within a week, a lot of patients note increased energy, improved sleep, and as early as the second week, a lot of their mind feels clearer. They feel like they have better concentration and things like that. And I think what a lot of people don't realize for dry January is technically what they teach us in medical school is alcoholism is more than 2 drinks a night for a woman and more than 4 drinks a night for a man. So whoever's watching this, if this is a helpful wake-up call for you to realize, like, oh, maybe those 4 drinks a night is too many, this is a good place to start. And whether it's dry January and cutting everything out, we're still in January, as you pointed out, you can start today, or participating in damp January, which is being mindful of your alcohol consumption and just drinking less, acknowledging you're drinking 4 drinks a night and cutting it down to 3, and that's great.
You can imagine there's a huge benefit from feeling a sense of control in an area like that where maybe it hadn't been out of control, but you had been overindulging.
Absolutely.
And you prove to yourself that I'm in charge of this.
Yes, and that I can do it. And I think, what a lot of studies have shown regarding dry January is it's, difficult for people with alcoholism because that addiction portion is very much into it. But for those of us, as you said, who indulge in alcohol, who came off the holidays of whether stressful family times and drinking or great family times and drinking, being aware that, oh, wow, we bought 6 bottles of wine for our family members for this holiday and they're all gone. And so I think it's, like you said, just really being aware and being able to recognize that I do have control, that I do have agency, that I'm not totally limiting myself, but I am also being mindful to do less.
Primary care, a lot of preventative care. What screenings are top of mind for that bracket you mentioned in your 40s?
Yep.
Where you get the wake-up call that we need to start screening stuff.
Everything is happening, yeah, exactly. So cancer screenings, most of them start at 40 for most patients. Mammograms for women start at 40. The U.S. Preventative Services Task Force, which is the governing body of how we define cancer screening and how your insurance actually reimburses it, they just changed the guidelines for breast cancer screening from 50 to 40. A lot of insurances were already covering breast cancer screening at 40, but now that the U.S. Preventative Services Task Force has recommended it, now almost every insurance payer should. So definitely just do it. Unfortunately, I have seen anecdotally, and I think some of the literature is showing that as well, that we are catching younger cancer in women. So even if you don't feel like you have a strong family risk of it, definitely talk to your primary care doctor about breast cancer screening.
Primary care, you see a lot of sick people. We're
Definitely.
in the middle of winter. What's going around?
Right now, I was actually just talking to our media relations about this, that tons of flu just today in clinic alone. We had 2 patients test positive for flu, And then right now, that you're seeing all over the news is norovirus, which is a GI bug, which is acute vomiting, lasts for about 24 to 48 hours, but those are what's going around everywhere right now.
Should I have masked up for this interview?
Great question. We are just about 6 feet apart, so I think we're okay. But actually, for norovirus, the most important thing that I want your viewers to know today is that the antibacterial wipes you use for that to clean your house do not protect against norovirus. So if someone is vomiting or having diarrhea, you've got to bleach it for at least 15 to 30 seconds and then wiping it down. And then the other thing for sure that I want everyone to know is to do hand washing with soap and water, not just hand sanitizer. Hand sanitizer is good enough for the flu right now, but not for that GI bug, the norovirus I mentioned.
Crazy that it does not work for the norovirus, what people call the stomach flu. If somebody could come up with whatever additive it is in there, they'd sell a lot of the stuff, especially to cruise lines.
Oh, 100%. I know, and we're so used to the cruise lines because you're just stuck on that ship, so everyone gets it. There's nowhere else to go.
How about vaccinations? Are you seeing people that, like the uptake of if you offer somebody a flu shot, a COVID shot, are they leaping to do it? Or are they hesitant? What are you seeing?
I'll be honest, I think a lot of patients are a little, they've sort of made their decisions on vaccines. A lot of patients either have always taken the flu shot and continue to accept it, and same with the COVID shot. And then some are definitely being a little bit more mindful and asking, for my personal opinions, what are your thoughts on the latest COVID vaccines? They are updating them every year. And so I would say it's still not too late, even though we're still in the middle of winter. I think a lot of people think to be preventative and do it more in the fall, but it's still not too late. We are still seeing the flu. So I would still recommend getting the flu shot and the COVID vaccine, the flu shot at least through March.
Interesting, the state database of the number of COVID cases in hospitals, it's ticked up over the last week or 10 days, but nothing like a year ago or 2 years ago. Hopefully a good sign.
Definitely. I think the vaccinations are showing that they are working, that, what the vaccines are doing, it's not preventing patients necessarily from getting COVID, but it is preventing them from getting hospitalized, from getting so sick that they need the ICU or the hospital help manage their care.
And as much as we love our Purell dispensers, your advice is go wash your hands.
Go wash your hands, use soap and water, sing happy birthday, then you'll know you wash your hands well enough.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.